morning, everyone. Thank you for being here. Today we have Guillermo Lazcoz for a seminar on AES research after the arrival of the EUI Act, something that is going to be a kind of nightmare for us all. So Guillermo is a researcher in the Impact Genomic Project, employed by the Center for Biomedical Research on Rare Disease. He's a member also of the Research Ethics Committee of the Instituto de Salud Carlos III, and is a PhD in law and from the University of the Basque Country with international distinction and an extraordinary award in the field of social and legal science, awarded with the Emilio Ace Research Award for the Spanish Data Protection Agency. So he's a kind of expert in this field. So let's start with the seminar. Thank you.
Thank you, Simona. Thank you for hosting me, Maria Jose, Simona, also Nuria for all the organization. It's a pleasure to be here. Lawyers and computer scientists, engineers, we don't usually understand each other, or we don't usually speak the same language, but today is not going to be that day. We have, I think, an hour, more or less. I will try to give you some insights into the AI Act that probably is one of, with the GDPR, one of the regulations that you have most heard about. And I will start with the latest news on AI regulation. Hi, everyone. You are not late. I started early. So the latest news is that Trump revoked a few days ago, a couple of days ago, Biden's executive order on AI. This is unknown territory for us. And at the same time, I think the next day, he announced that he's investing it's building an artificial intelligence infrastructure with 500 billions for the private sector. I think this is not good news for AI. And not because of the revocation of the executive order, that I also think as a lawyer, I don't think that there should not be any regulation at all. We don't know what is going to be the regulation, because probably Trump will going to have a new regulation, softer regulation, but especially the race with the 500 billions on AI, I don't think that race on AI will be a good thing for the tech guys that want to develop AI for all and for society. Probably this will contribute to the AI bubble, and an explosion of that bubble will probably be not good for you all, and neither for me. I will briefly introduce the AI Act, and then we will talk about health and research in the AI Act. So, regulation that was published 12th of July last year. The EU wanted to replicate the symbolic power of the GDPR. The EU knows that they cannot compete with the USA or China on the technological power part. So regulation is one of the fields where the EU can be persuasive to others. Not the case, seeing what happened in the USA, but we'll see. The aim of this regulation is to improve the functioning of the internal market and to promote the adoption of human-centered and trustworthy AI. The regulation entered into force in August 2024. in next week, it will come into force the prohibition of some kind of AI uses that we will see. On August, all the regulation regarding the general purpose AI. August 2026, high-risk systems. There are two kinds of high-risk systems. We will see how this is regulated. So for the Annex 3, August 2026, August 2027, high-risk devices. Here we will link the medical devices with the high-risk AI systems, you will see. So the definition of AI, that was one of the most discussed things before the approval of the regulation. AI system means a machine-based system that is designed to operate with varying levels of autonomy and that may exhibit adaptiveness after deployment. If you read it, you probably will see that it's kind of broad. And this is, at the moment, is one of the problems to interpret what the definition covers, what kind of technologies are in the AI Act and what kind of technologies are not. There are some guidelines expected on the definition for this first quarter of 2025, and I added to the PowerPoint. You can, if you want, you can access to this European Law Institute's proposal that I liked, because they propose 3 factors on which you can say what is a whether a system is AI according to the AI Act or not. 3 factors: the use of data or domain-specific expert knowledge in development, from data-driven programming to no domain-specific data analysis and no expert knowledge. The second factor, the creation of the system of new know-how during operation. And the third factor, the formal indeterminacy of the output. And then they showed some examples of different applications and how the factors were applying to those cases, and in the end, whether it is an AI system according to the AI Act or not. This paper is kind of interesting if you want to know what kind of systems could be or could not be applied to the AI Act. And about the life cycle of the AI systems in the AI Act, 2 main stages in the regulation: the development stage and the use stage. The difference or the line between them is whether the system is placed on the market or put into service. Okay, so once the system is in the market, we are in the use stage. During the development stage, the main role, the main actor is the provider, the one who develops the systems with a view to commercialize it. As you know, there in the development stage, you have the training, validation, and testing. That doesn't mean that once in the market there is no more training, validation, or testing. It can happen with many AI systems, as you know. So once it's in the market, the main actor is the deployer, anyone that is using the system under their own authority. And here we have an AI system that is going to be CE marked, as many of the products that you use every day that have this CE mark from the EU. Okay, so this is going to be the AI in the EU context, taking decisions normally with a human supervisor, because this is one of the new roles that is required by the AI Act, and the people impacted by the decisions of the system. So, well, this is the AI tool life cycle, more detailed, and the line there between placing it on the market and so on. So what kind of regulation we have here? It's a risk-based regulation, meaning that at the top we have any system that violates EU fundamental rights. We have the unacceptable risk layer, okay? There we have systems like the example here, a system that deploys subliminal techniques beyond a person's consciousness or purposefully manipulative or deceptive techniques. Bueno, subliminal techniques. Are you just in my mind, or? So the unacceptable risk layer. Okay, many of the systems that you see here in the Article 5 for me, or either they are quite vague like this one, or either I see that they were already prohibited but by other lawyers, or other laws, sorry. Then we have the high-risk layer, meaning that AI systems could impact on health, safety, and fundamental rights. This is the heart of the regulation. Almost all the regulation is focused on the high-risk system, and as I already introduced, there are two kinds of them, which will have to comply with some mandatory requirements that we will see. Then the transparency risk layer, chatbots, deepfakes, AI-generated content that the Commission considered that needed some kind of transparency obligations. No, they are not high risk, but people at least should know that they are interacting with AI generated content, okay? And then the minimal risk, that are the rest of the AI systems that are not included in the regulation and are not subject to the AI Act. And then the elephant in the room, the first proposal of the Commission was April 2021. Everything was working perfect in this framework, and then ChatGPT was launched in, I think it was November 2022, something like that. And general purpose AI arrived, and they had to do something with it. There was a big discussion in between the states. About different kinds of regulation, and the regulation that won the battle was a kind of soft regulation with some general obligations that we will see, and some higher obligations for general purpose AI with the systemic risk that is defined in the law. So I will start with the last, with the general purpose AI. While developing, if you are developing any kind of GPA, you should take into account that providers must document technical information about the model for the purpose of providing that information under request of the AI office or national competent authorities. Okay, also they must put in place a policy to comply with the union law on copyright and related rights. This is one of the biggest fears of the regulators, and make publicly available a sufficiently detailed summary about the content used for training the model. Okay, those are the general obligations, and then we have some additional obligations for the systemic risk systems, like, for example, ChatGPT will be a systemic risk general purpose AI. And then those obligations are about kind of assessing the risk of the system and mitigating or explaining what kind of mitigation practices you have for the use of the system. And what is the key of this part of the regulation? That we will have an AI code of practice for the EU, meaning that a developer of GPA AI that follows the code of practice will be presumed that is compliant with the AI Act. So for this, here you have the second draft that was published a few days ago, and we will have the third draft of that code by August 2025. That is when the regulation for the general purpose AI systems come into force, okay? And if we are using those systems for biomedical research, three questions that we should have in mind. Okay, the first one is the system that I'm using compliant with the AI Act, with the GDPR. That question probably is difficult to research. You could access the privacy policy that the system has, but it's probably difficult to read for all of you. And probably they will say that they comply with all the laws, and it's a lie. So that question is not very useful, in fact. The second question, what does my institution say about the use of GPA AI? That is important for you. Please do not do, in your case, your workers of the Barcelona Supercomputing Center, please don't use the computers of your institution not complying any kind of instruction from the institution, because that could compromise a lot of the data that you use there, okay? And then the third is the method by which I introduce AI into my research sound. For that, we have guidelines. This is one of the official ones, but then you have also other papers, comments, and in specialist reviews that you can check, and I definitely recommend you that if you use those systems to follow them, okay? So the high-risk layer. This, as I said, this is the main layer, and it adds some requirements for the systems. Those requirements are here, and the one that should implement them are the providers, those who develop the system to put it in the market before placing it in the market. Then we can talk about those. And the conformity assessment procedure, this is just for you to know that for having that C marking, my AI system has to have this C marking. For that, you have to comply a conformity assessment procedure, and that procedure normally, or at least with the systems that we will today talk about, they are subject to the assessment of a notified body under the legislation, okay? Then other figures that you should take into account and not mistake with the conformity assessment procedure, the data protection impact assessment that is required by the GDPR. It's about the risks that pose the processing of personal data. And then the fundamental rights impacts is a new figure that is required for the deployers and not providers. Deployers are those who use the system under their authority. Okay, so this new figure will feed a lot of lawyers. We will be fed by this new figure, but in general, it is about also assessing the risks that an AI system poses into a concrete context of use, okay? It's about that. And another figure that is new under this regulation are sandboxes, regulatory sandboxes. Spain is the first, I think, that launched it, the first country that launched its own sandbox. And you have still opened the the call to apply for one of the sandboxes. Okay, so, well, more or less on time. Questions? Yeah, it's just if you have any doubts for the moment, you can understand a bit of the whole regulation. Yes, no, well, let's go with the health part. How is conceived health in the AI Act? Okay. We know that health risks are a priority. In fact, with this, you will see all the time during the regulation the health, safety, and fundamental rights risks. So health is a priority there as a risk. Healthcare is also a key sector for the regulation. There are high expectations about what AI can provide to our healthcare systems. And we will see also the connection with the European health data space between this regulation and the European health data space that will come soon. And we see that health-related systems, we will see how, are conceived as high risk. The Commission wants to promote them, but at the same time knows that health risks are a priority, so health-related systems go to the high-risk layer, okay? And as I said, there are two kinds of high-risk AI systems. The first is that on Annex 3, the Commission says, okay, those kind of uses for AI are high risk. I define in the law the uses that I consider high risk. So this is like the first kind of high risk, ad hoc high risk. And here we have three kinds of health-related high risks. AI systems that determine the legitimity of natural persons for healthcare services. AI systems that are at the emergency healthcare patient triage systems, yeah. And risk assessment and pricing for health insurance. So those uses are, because of the use of the system, are high risk. And then we have another way. And here the Commission says, okay, I have a lot of products that I already regulate with my own sectoral legislation. For example, I think we have here elevators too. So I can take the elevators that I already regulate and say that if I consider them high risk in the sectoral legislation, and at the same time you have an AI system that is the component of an elevator, I will consider it an elevator on the sectoral law and at the same time a high-risk AI system. And what happens here with the regulations concerning health? That we have the medical device regulation and the in vitro device regulation. Let's see with some examples how this is translated into the law. So in the medical device regulation, we have the definition of a medical device, okay? Means any software intended by the manufacturer on one of or more of the following specific medical purposes: diagnosing, prevention, monitoring, prediction, prognosis, treatment, or alleviation of disease. So any software that is intended to diagnose a disease is a medical device, okay? This is qualified as a medical device. And then we have a classification in the medical device regulation, meaning that medical devices can go from class 1 to class 3. And the systems that are class 2, class 2A, class 2B, or class 3 have to undergo a third-party conformity assessment. You remember the conformity assessment that I said that was in the AI Act? Okay, so this is the same. The sectoral law, the medical device regulation, already is asking for a conformity assessment. For what kind of systems? For any medical software, in general, they are class 2A, except if the decision of the software can have an impact that may cause either death or an reversible deterioration of the person's state of health, in which case is class 3, or a serious deterioration of the status of health or surgical intervention, which is class 2B. You have the guidance on the qualification and classification of software available. Yeah. Okay, so this is for any software. This is the thing. So any software that has a specific medical purpose and it's classified according to these rules is a software barra medical device, okay? If it has to undergo a third-party conformity assessment, it is also considered by this regulation a high-risk AI system, if it's AI. And so we have to go back to the definition that we had in the beginning, okay? So if it's AI, if it's a medical device, and if it has to undergo a third conformity assessment according to the sectoral law, we have a high-risk medical device, high-risk AI medical device, okay? And the same for the in vitro medical devices. Here, the software which drives a device or influences the use of a device shall fall within the same class as the device. So, for example, if the AI system drives or influences any of the, for example, class B devices intended for self-testing or for fertility testing. Class C devices intended for human genetic testing. Class D devices intended for determining the infectious load of a life-threatening disease. So the thing here is that we don't have class 1, 2, 3. We have class A, B, C, D. And the rule for the involvement of a notified body in the conformity assessment is that class B, class C, and class D needs the involvement of that notified body in the conformity assessment. So it works like the other one. The difference is that the classification is different. So we now know what are medical devices, are in vitro devices that contain software. And we know that if those devices have AI, now are high-risk AI medical devices. And what's old in the regulation and what's new with the AI Act, because now they have to merge. So we already have, well, we already had the AI for medical purposes regulated. That this is one thing that in many forums I find people surprised. It is already regulated. It is already there. I mean, if you develop AI with a medical purpose, it is already regulated, okay? So this already was there. And we have to have a conformity assessment supervised by the notified body to obtain that CE marking for the medical device. We have to demonstrate the general safety and performance requirements of that regulation. We have to perform a documented clinical evaluation, some risk-based extra requirements. The requirements are not the same for class 3 to class 2A, and then post-market surveillance measures. And what's new? Now, the procedure will be the same. This will be the same, but new requirements are asked to place an AI system, high-risk AI medical device system. What kind of requirements? Risk management system, data governance, technical documentation, record keeping, transparency requirements, human oversight, and accuracy, robustness, and cybersecurity requirements. Some of them are already here. For example, the accuracy, robustness, and cybersecurity requirements are already on the medical device regulation, but they have you have just to demonstrate compliance with the ones that are new to the regulation. And what about AI systems in biomedical research? There we have kind of surprise of the regulation, because all the other health-related systems are on the high-risk layer. But here we have an exception. It doesn't apply to AI systems or AI models, including their output, specifically developed and put into service for the sole purpose of scientific research and development. The background of this is that, and so says the Commission, the AI Act should support innovation, should respect freedom of science, and should not undermine research and development activity. Here I think that there is a confusion between innovation and research. In the drugs pharmaceutical market, we have a highly regulated kind of research that it's in principle not an obstacle for the innovation. And so it surprised me a little bit, this kind of statement from the Commission, because the regulation from for the pharmaceutical industry comes from the same legislators, and consider it the regulation a good thing for having research and innovation in through the right path. But well, so the key here is that if you don't have a medical device, I mean, if your AI system doesn't fall into this definition, if it does not do any diagnosis, prevention, monitoring of the disease, or any kind of the devices that we see in the in vitro device, and we can justify that it is for the sole purpose of scientific research and development, the AI Act will not apply to that system, okay? That doesn't mean that you don't have to comply with any laws, okay? The GDPR is there for the personal data and so on. And you have in the AI Act this disclaimer. In any event, any research and development activities should be carried out in accordance with recognized ethical and professional standards for scientific research, and should be conducted in accordance with applicable law. So the AI Act does not apply, but if you are conducting a clinical evaluation, you have to go through a research ethics committee, you have to comply with all the law, okay? And then we have another note that could be interesting, that is that the AI regulation does not apply to any research, testing, development activity regarding AI system prior to their being placed on the market or put into service. What does it mean? That in fact, for all the development activities, all the development research, we have to go back to the national law and the medical device regulation requirements for that. I mean, for what kind of clinical evaluation we have to follow, we should go to the medical device regulation because the AI Act doesn't regulate that part, okay? And the exception for that is the AI regulatory sandboxes. Is the only thing that is an exception. And not bad. I think this might be the last show. Good, in time. The last thing that I wanted to bring here is the connection between the European health data space that will be a regulation in a couple of weeks. It was approved by the council, and now we are waiting for the official publication. So that will happen, yeah, really soon. So what we have in the, as I said before, there are high expectations for AI in the health sector. And those expectations are translated in this connection. So the AI Act says that, for example, in health, the European health data space will facilitate non-discriminatory access to health data and the training of AI algorithms on those datasets in a privacy-preserving, securely, timely, transparent, and trustworthy manner, and with an appropriate institutional governance. Meaning that for the compliance of the, I have it here, for the data governance requirements of high-risk systems, where data should be representative, where data should be quality data, where data, there are many requirements, the AI Act thinks that this could be achieved through the European health data space. What will do the European health data space? Will allow the secondary use of the health data that we have in all kinds of public and private healthcare sector institutions, meaning that all that data will be available for those uses, secondary uses. Among them, scientific research, and this scientific research defined, as you can see here, with the aim of benefiting end users such as patients, healthcare professionals, and health administrations, including medical devices, including training, testing, and evaluation of algorithms, AI systems, and digital health application, apart from the medical devices and the in vitro medical devices that are already included. So we have the data governance strategy of the EU here, merging two new regulations, saying that if you want to have a data governance compliant AI system in the healthcare sector, you can go to the European health data space and ask for the data that you need to, for example, hospitals of Germany and Lithuania, I don't know, to validate your own AI system. And you will be allowed to ask for that data to train, to validate, to test your own AI system. And this is the last, I think, what things you have to bear in mind from the presentation. The implementation dates, okay, prohibition of AI uses in next month, general purpose AI for this summer, in a year and a half, high-risk system of Annex 3, in 2 years and a half, medical devices with AI systems. This question you have to make yourself. Do I already comply with the medical device regulation? Don't forget that AI health systems are already regulated as software medical devices. Is my software just a medical device or a high-risk AI medical device? The difference is whether your software is included in the AI definition of the AI Act or not. The two kinds of high-risk systems. For systems with sectoral legislation, no change in the procedure with a notified body with a conformity assessment, but you have the material conditions, meaning the requirements added by the AI Act. Then the exceptions that we saw for is my AI system meant for the sole purpose of the scientific research and development, and then these figures the Fundamental Rights Impact Act, the Data Protection Impact Act, and then for general purpose AI system final recommendation. Law is not everything, meaning that the regulators, I think they were quite lost when ChatGPT was launched, and they were lost a year after ChatGPT was launched, and they are still a bit lost. So we should bear in mind that for a responsible, sound methodology of the use of a general purpose AI in research, we should at least see what our community is saying about good practices and so on. And just a bit of the publicity kind of a commercial. We are developing some guidelines for AI projects in the National Association of the Research Ethics Committee, ANCEI. In this work group, we have three groups divided in technical knowledge, ethic, methodological knowledge, and legal knowledge. And it's this group where you can see Guillermo Lazcoz, me, and also Simona. So we expect to have those guidelines for May, maybe June, I don't know. So they will be open access and published, and I hope they are useful for you. And that's all.
For questions, any questions? Should the microphone for the other?
Hi, about the data governance, does it mean that now we'll have only one data access committee that will be Europe when we are asking data? So I want the data from this hospital. I will ask to the this data governance committee in Europe, and they will say, yes, you can take it.
Okay.
Okay, here.
You are talking about the European Health Data Space.
Yes.
Okay, this deserves at least another hour of my time, but
okay.
But
okay.
no, okay. I can briefly explain. They will be some. They call them health data access bodies.
Yeah.
This will be depending on the political, territorial kind of structure of the country. For example, in Spain, we hope to have at least one for each comunidad autónoma, for each region, and then so you will have to ask for the health data access body that has the data of the data holder. That is the one, the hospital that has to make available the data. So you will go through a public administration that is called Health Data Access Body. And then there are different procedures. If you are asking just for data of one data holder or more than one, there are different procedures, but that is the system, so to say.
Okay, thank you.
Thanks.
Hi, So I have a question about the enactment of the AI Act on living software. So software that is getting new functionalities. So let's imagine that you are having a software that is placed under a risk model. How would you reassess that risk model when new functionalities are added to that software?
I don't know if I understood the question well. So
So
you,
uh, I don't know if I'm explaining myself, but when you have a kind of software that uses AI, for example, generative content, ChatGPT is something. At first, it was only text. Now you can also input images, something like that. That's a new functionality. So, how would the AI Act reevaluate with new functionalities
okay,
that software?
okay. So the thing is that it's different for whether you are in a high risk system or just in the general purpose AI layer. Okay.
Mhm.
In the high risk system, you have a definition of what is meant. Uh, yes, I cannot recall the name, but it's like a substantial modification or even a dysfunctionality. It is defined in the law. So once the deployer or the provider knows that this is happening, and if it fits with the definition of the law, uh, you should you should reevaluate that in the conformity assessment,
Okay.
especially if it poses new risks.
That's what I was going to ask. What if the risk level changes with that new
Yeah,
functionalities?
the thing is that the the risk of the system, the layer the layer here will not change even if there are
Okay.
new risks. It will not change. Why? Because the layers are meant depending on the use and not on the risks
Mm.
itself. We call it a risk based, but it's depending here. You are making this governance framework
Yes.
based on the risk of the use,
Hmm.
not on the risk that actually come.
But what I'm trying to say, I'm sorry,
Yeah,
I'm
yeah,
totally sorry. But what if you add another use that is
yeah.
different
That is
from
the
the
thing. If you
like
add
can it move from
another
in the
use,
pyramid?
it can change. I
Okay.
mean, if you are in a high risk use, for example, uh, okay, so you have an AI system for the risk assessment and pricing of health insurance, and suddenly, well, not suddenly,
Suddenly.
but your system starts to deploy subliminal techniques for you to, for example, I don't know, to confess
Your sins.
health issues that you don't even have. Let's say, let's make something up. Then you will fall under a
Okay, so
prohibited
you
AI practice. Yeah,
okay.
but the risks, so to say, have to change the use
Okay.
to change the layer here.
Okay.
So it's a bit confusing because if we are talking about the risks that a high risk system is posing, for example, a diagnostic tool
Mhm.
that suddenly starts to function yeah, really badly and starts to pose new risk for the life of the patients, then what you are not complying is with the mandatory requirements of safety. And then, so the layer of the system doesn't change. What the regulation there says is, okay, you have a new risk, so go through the conformity assessment again and prove that this system is safe. Okay.
Okay.
Well, thank you.
Thank you so much.
No, thanks to you.
Thank you.
Other questions?
Guillermo, thank you for the really nice presentation. I have like 3 million questions, but I will do just two.
Uh,
First one is about the conformity assessment. We see there are conformity assessments in the in vitro diagnostic, in the medical regulation. We see conformity assessment in the AI Act.
okay.
Are we talking about the same procedure,
Okay.
or they are different?
That's a good question. So, in theory, the Commission wanted to bring here an economic kind of regulation, meaning that we don't want duplication of procedures. So, we will have to follow the path of the sectoral, meaning that we have only the conformity assessment of the medical device regulations, but there, for example, the notified body should have, for example, people trained on the evaluation and assessment of AI systems. So if we go to the detail, is a bit more complex, but what I expect is that we have this guidance here. The medical device coordination group, I hope, because they actually, I think they released a press note, I think, on that they will give some guidance to let the providers know how to merge both of them. We will have, the conformity assessment of the medical device regulation, but we will explain you how to merge everything into one procedure. This is what I hope will happen. That will clarify everything. And I hope it will happen. Well, we have 2 years for that, but that it will happen soon. Yeah.
Perfect. Thank you. And the other question that I have, I use a little bit of uncertainty when you were explaining that for biomedical AI system, the model, there is this assumption, like you don't need to comply with the AI Act because you go back to the NDR, IVDR, and the national law. Problem is that usually we operate at the European level. And many national laws, they are really divergent. One say white, the other blue, and the other black, and then you're in a mess, right? So in this particular case, will be ideal to follow the European Health Data Space Regulation and say, well, if I comply with the European Health Data Space Regulation, somehow, especially for data governance, I will be in the compliant side.
It will be...
Bueno, ya viste que creo que no sabe.
It's just in my mind. I know it. I almost forget the question now. Yes, I think that, we have trouble, especially in developing those AI systems, because you're right. The MDR, the IVDR is the same for all, but for example, the GDPR, national laws can introduce different safeguardings and conditions to use health data. So this is actually, yes, an obstacle for research introduced by the law. This is one of them. There are. So, as you say, the European Health Data Space is a great opportunity, especially for the development of those systems, because we are suffering this particular obstacle, and actually the European Health Data Space says so, that it is in the European Health Data Space, it is not applicable that exceptions of coming from the GDPR in national laws. So I think it will be a great opportunity to remove that obstacle and have a multi-country EU-level AI developing systems. Yeah, just two. Okay.
We'll go to lunch. Do you have other questions? Are there any questions online? It's okay, so we can...
In time.
Perfect. It was perfect. So thank you very much, Guillermo.
No, thanks to you. Thanks
all.
everyone
So
for coming.
let's keep
It's a pleasure.
learning about this.